Your treatment regimen at MD Anderson Cancer Center may require an implanted port. A port is a small device placed under the skin which is connected to one of your major veins. A port delivers medicines, fluids, or blood. Power injectable rated ports may also be used for certain diagnostic tests. Having a port may also make treatment more comfortable by reducing the number of needle sticks. During surgery, the port is placed under the skin. After surgery, you will see or feel a small, raised area or bump about the size of a quarter. The port may be used the same day. If you have steri strips, they will fall off in about 2 or 3 weeks. Do not let anyone remove the steri strips unless approved by your surgeon or the Vascular Access and Procedure Center Port Clinic. It is okay to trim the edges as the steri strips get loose. If you have suture knots, they will be trimmed in 1 to 2 weeks. You will have a dressing over the incision on your chest and lower part of your neck for the first 48 hours after insertion. Do not get the dressings wet during this time. You may wash around the dressings. You can remove both dressings after 48 hours, but do not pull off the steri strips, surgical glue, or suture knots. You may shower if the port is not being used for treatment. You may feel sore and have some swelling and redness at the incision site for the first few days after the port insertion. These symptoms are common after the procedure. Call the Vascular Access and Procedure Center Port Clinic if you have any of the following symptoms: worsening swelling, redness, tenderness, or heat, bleeding, drainage or discharge from the incision area, pain that gets worse, skin separation. Go to the nearest hospital emergency center if you have severe pain or pain that gets worse, fever of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, shortness of breath, swelling in your arm or neck. If you are an inpatient and have problems with your port, ask your nurse to call the Vascular Access and Procedures team. You will receive a Medical Alert Identification ID card with important information about the port, brand name, type of port, and lot number. Keep it with you in a safe place. The port may be made of metal or plastic. It should not set off any security alarms. If it does, show your Medical Alert ID card. To receive treatment, a member of your care team will insert a special type of needle through the skin and into the port.
I'm gonna count 1 to 3. You take a deep breath. You're gonna hold your breath, and I'm gonna poke. Okay?
Okay.
This process is known as port access. The medicine moves through the catheter and enters your bloodstream. Your care team may prescribe a numbing cream to use 45 minutes to an hour before accessing your port to help ease discomfort. Do not rub the cream in. Use any store brand plastic wrap covering and place it over the area. Do not use a bandage. If you do not use a numbing cream, your care team may use a numbing spray. Tell your care team if you have any allergies or sensitivities to this type of spray. Wear a loose and comfortable top when your port is going to be used. This helps your care team to keep your port area clean and prevent infection. Your nurse will flush your port after each treatment. If not in use for active treatment, you should come to the clinic every 4 to 6 weeks to have your port flushed. When it is no longer needed, your port will be removed in either the operating room, the interventional radiology department, or in vascular access and procedures.